Very good evening, friends. Meeting again in the session of Materia Medica. And we have finished very important remedy in our day-to-day homeopathic practice, that is sepia, in last lecture. And today we're going to learn one more remedy, which is also useful in our homeopathic practice for the chronic cases, and which is also a multidimensional polycrest, which had its which had a deep action, very chronic in its action, covering psychosyphilitic miasm, the cancer miasm, and that is the Staphysagria. Staphysagria, we used to consider only for few things. Many times it has been overlooked, never understood properly. And there was only one thing that which is fixed in the student's mind or even practitioner's mind, that this is the remedy for severe anger. So, Staphysagria, we have to understand with different aspects. It has action of 20 to 30 days, but it has a miasmatic background of psychotic as well as syphilitic aspects. So cancer miasm covers under this specific remedy. And we have to understand this remedy with two cases I will going to share. Both cases were chronic in my practice, way back I have treated, but generally we think that Staphysagria is deep acting remedy, but it is a wonderful remedy specifically for a recurrent styes. There was a case of a child who, who was nearly about 8-9 years of age and came to me with a continuous recurrent styes in last 1 year. Treated with allopathic mode of treatment. They used to give the antibiotic drops and he used to put that drops again and again. And one after another, every time the sty was developing. They have changed the doctor, they have given internal antibiotics, but nothing stopped that. So they brought the child to me and I was taking his case. Little bit, there was little bit anger on his face. I asked, what is wrong with you? Actually, he was playing and he never wanted to come for the consultation at that specific time. He was saying that we'll go tomorrow, and his mother brought him for the consultation. There was tremendous anger, but he cannot do anything against his parent. That anger was there in his eyes. And that then I asked, then why do you come? He said that, what can I do? I can't do anything. I have to be. And when he says saying that I have to be, the anger was there in his face. And he was looking with very angry face towards his father, towards his mother. And he was so disturbed. That type of suppressed anger is the characteristic of the Zati. When a person cannot do against an authority, even though he is right, the anger which develops is the anger of Staphysagria. The anger is there inside that he wants to do something, but he can't. Such type of anger is the Staphysagria anger. And Staphysagria is the only remedy mentioned in complete repertory under the styes recurrent, and only remedy was the Staphysagria. I have given him Staphysagria 1 Staphysagria 200. And I have given 3 doses on day 1, 3 doses on next day, and asked him to meet me after 4-5 days. The styes which were there on the upper lids disappeared completely after 5 days. And there was no recurrence within 5 days. So he was happy regarding his problem. Then I have kept him on placebo, and it was continued for another month. I observed him another month. There was no recurrence. And he was continuously on placebo for another month. After 2-3 months, one day he came with again a sty on left lower eyelid. And then I have given a little bit high potency, 1 m, one dose only, and observed him for next 2-3 months. And there was no recurrence of the sty. This is a wonderful remedy whenever the styes recurs one after the another, either upper lid, lower lid, but there is a state of Staphysagria should be present. That state, severe state, that is very marked with the Staphysagria. And that you have to take into consideration regarding the Staphysagria. Disease might be anything. The state is very common. It is a reserved displeasure. He keeps that inside. He is displeased, but that he never likes to show it to the others. He keeps inside. He keeps anger inside suppressed, is the Staphysagria. And that you can observe on the faces of the Staphysagria person. And that is what he has mentioned about, or that is what was present in that case. There was one more case. We were on trip. Just it has happened 7-8 years back. We were on trip with Kesari Travels, and we were there at what is that? Manali, Kulu Manali. And along with us, in that Kesari tour, there was a newly married couple was there. And in the group, there was an interrogation, and then there was introduction, and all people, they know that we were two doctors in the trip. And what has happened the third day of the trip, and that girl who was newly married was crying tremendously. So my wife, she asked her, what has happened? Why you are crying? And then she explained the story that she had a very severe burning micturition, and they had first time intercourse 2 days back, and thereafter she started getting very severe burning. Then they have taken certain medicines as explained by, as mentioned by their family physician on telephone, and they purchased it, they took that antibiotic and everything, but pain was not getting settled. And she was in a agony, and pain was so severe. They were searching whether they will take some injection or for that some. So my wife, she asked, is there any homeopathic medicine along with me? Because I was carrying homeopathic first aid box with me along with some proper common medicine. And then she told the whole story. This is typical honeymoon cystitis, which has developed in her case, not responding to the antibiotic, few doses of antibiotics, and she was in agony. And luckily, I was having Staphysagria with me. Staphysagria 200 was there with me. I have given Staphysagria 200, 3 doses every 15 minutes to her, and asked her, please let me know after another hour, how do you feel? She took the first dose, and she felt sleepy, and she went into sleep. We were traveling. She was sleeping. She forgot to take another dose after 15 minutes. So after 1 hour, when she got up, she asked, sir, I have not taken second dose. I felt completely, I slept immediately after that. And then I asked, how are you? She said, I'm feeling better. I don't have a pain now. So single dose of Staphysagria worked. I said, no need to repeat. Keep those 2 doses with you. If you have a recurrent problem, you can take those. Staphysagria is a very important remedy where such type of honeymoon cystitis is quite common, and this happens because of short urethra with the females, and if it is a first time intercourse happen, many times many ladies suffers from such type of severe pain, burning pain at the urethral meatus, with some, as if some part of urine was remaining continuously with urging. And that remedy is Staphysagria, works instantaneously, even though it is a defecting remedy. So these are two cases which shows you that Staphysagria is not only the remedy for the chronic disorders, but it is also a very good remedy for acute manifestations, and it works instantaneously in acutes. So this is a wonderful remedy which we have to learn today from Allen's keynotes. Open Allen's, it is Staphysagria. It is a plant from Ranunculaceae family. The remedy was first proved by Dr. Samuel Hahnemann. This remedy is quite depicting. It has 20 to 30 days of action. For the mental effects of onanism and sexual excess, first sentence defines the site of action. These are the persons who are sexual dwellers, specifically in males. This is very common remedy for who used to think sexually. There is a tendency to masturbation. They are always thinking with the sexual mind, and that creates the problem with them. Very sensitive to the slightest mental impressions. They are very sensitive and react instantaneously to the situation. Least action or harmless words offends them. So they get offended very easily because of slightest words which are used. Ignatia goes into the weeping mood because of such words. Staphysagria goes into the angry phase, but anger, it is suppressed in Staphysagria. So they get disturbed and they want to revolt, but they can't. Great indignation about things done by others. This is very important. So something is bad is happening over there, and they looks and they get indignated, severe anger, but they can't do anything. Great indignation about things done by others or by himself, grieves about the consequences. And there is a grief which develops, or that same thing because of which the consequences, that goes on thinking what will happen now and what will going to happen in future. Staphysagria is the remedy for such a sensitivity. So something wrong has happened from them, they get disturbed. Something wrong has happened from others, they become sensitive. And their anger remains very strongly inside. And they start thinking what will happen to them, what will happen to me, what will happen to others. All those things, those goes on continuously in their mind. Apathetic. They keep things inside, never talk so much. Indifferent, low-spirited. There is no so marked spirit that they will fight. No. Weak memory from sexual abuses. So loss of memory, weakness of memory due to the sexual abuses, anacardium, aurum, natrum, phosphoric acid, these are close remedies to it. Elements from pride, envy, and chagrin. Pride means self-pride, self-esteem, ego. Envy is nothing but the, I say, it is malicious aspect with the others. Some disturbance was there in between, something has happened. So there was chagrin. Chagrin means a tremendous anger which happens to be there. That is very typical with the Staphysagria. Ill-humored children, cry for things which after receiving, they petulantly push and throw away, like creosote, like senna. So they craves for certain things. But if it has been not got, they never got it immediately. And if you give it after some time, they throws them away, then they reject them. It is very close to the creosote, it is very close to the senna. So these are children who are ill-humored, their nature is not normal. The anger looks on their, you can observe that anger. Was insulted feeling, elements from mortification, elements from indignation, mortification with indignation. Staphysagria is the remedy. Insulted feeling remains inside, and the anger which develops, which remains persistently over there. Was insulted, being too dignified to fight. So someone who is abusing him or her, and because of dignity, they cannot fight, they cannot show. Anger is there, but they cannot show there because of dignity. Subdued his wrath. So wrath is tremendous anger, krodh. Subdued, they tries to subdue it, suppress it, and went homesick. So because of suppressed anger, the sickness develops. So elements from mortification with indignation, this is the cause. They went home sick, trembling and exhausted. That is the reverse of Naksomika. Naks fights. Naks never keeps it inside. Naks goes immediately to fight with the situation. Staphysagria keeps it inside more commonly. Sensation of round ball in the forehead sitting firmly there even when shaking the head. So there is sensation as if round ball is fitted, fixed inside the head, that specifically forehead. That is very typical sensation. Sensation, ball-like sensation inside the abdomen, inside the inner parts, is sepia. That's what we have learned in last lecture. But here it is specifically in forehead, that sensation which is there. Mechanical injuries from sharp cutting instrument. This is a very good remedy post surgically. Clean cut wounds for the healing purpose. Staphysagria is a wonderful remedy. So, mechanical injuries from sharp cutting instruments, post surgical operations, stinging, smarting pains like the cutting of a knife. And these are very, very clean cut wounds where Staphysagria heals them with the post intention. It is a wonderful remedy to be utilized as a stimulant for healing purpose, and it recovers the wounds very clearly. So Staphysagria, one should add in such types of cases as a single dose or 2 doses. For the bad effects of onanism, onanism is sexual dwelling, bad effects of sexual excesses, bad effects of loss of vital fluids. Here, loss of vital fluids, it is related with the seminal losses more commonly. Semen is a vital fluid. Bad effects of chagrin. Chagrin is again a tremendous anger. Mortification. Apman. Mortification is nothing but the insulted feeling. Insultation. Bad effects of unmerited insults. So insults in front of peoples, very marked. They gets insulted and they gets the problems because of that. Bad effects of indignation. Indignation is the anger, which is tremendous anger remaining inside is indignation. Bad effects with vexation. Vexation is they want to fight, they want to go for fight, but they can't. But that santap, we can in Marathi we call it santap. That is that they their fist there becomes very tight. They put it on something else, or even on door, on the walls. That type of vexation is there, or reserved displeasure. Displeasure. There is a displeasure. There is no. They never liked whatever have happened, but they keeps it inside. Then that is reserved. They never shows that displeasure in front of others. So that is very typical with the Staphysagria. These words defines the Staphysagria state. Aurum is also one more remedy, but aurum goes into the suicidal state. Aurum goes into the depressed phase very easily. Otherwise, aurum is dictatorial and aurum wants to rule. But such things makes him absolutely opposite, negative phase. Aurum goes into the severe depression because of that. Nervous weakness, as if done up after much hard work. So it is weakness of the nerves, and that weakness of the nerves, as if done up after the much hard work, very hard work they used to do, and after that they get exhausted, they get suffered with the nervous weakness. Now that symptom, see, styes, chalazion, on eyelids, on upper lids, one after another. Underline this. This is very important. One after another. Leaving hard nodosities like chalazion, leaving hard nodosities in their wake. Conayam, thuja, these are two remedies mentioned, but many times you never requires conayam or thuja. Many times Staphysagria covers of that state. I have seen that. I have treated many styes cases with the help of Staphysagria. Very occasionally, I required thuja as an intercurrent in such types of cases, but many times Staphysagria covered that chalazion or recurrent style. It is again a very good remedy for toothache. Very important remedy. Many cases, whenever there is a toothache, and even warm is also aggravating the toothache, and cold things also aggravating, and tooth is too sensitive when there are ridges over there or teeth is decayed at the borders, then I used to think of Staphysagria, and few doses of Staphysagria stops the pain. It is a wonderful remedy in such types of cases. Toothache during menses, a very important modality given in italics. Toothache, sound as well as decayed teeth. So toothache with sound teeth as well as decayed teeth. Toothache, painful to touch of food or drink, but not from biting or chewing. It is not because of biting, it is not because of chewing, but aggravated. This toothache is aggravated, drawing cold air into the mouth. So even patient takes a breath from mouth, and that air also causes a severe pain. That much sensitivity is present in Staphysagria. So see, these are very essential things. Aggravation from cold drinks, aggravation after eating. So touch aggravates it tremendously. Teeth turn black. So see, teeth turn black, show dark streaks through them, cannot be kept clean. The teeth you cannot kept clean. Teeth crumbles. Crumbles means they breaks easily. Decay on edges. On the edges they get decayed. At the roots it is mesothelium and thuja. Psychotic remedies very characteristically. And scorbutic cachexia. Scorbutic cachexia means it is the gingivitis. And patients are suffering from gingivitis along with the teeth which are crumbling, and specifically at the edges. The decay happens at the edges. Staphysagria is a wonderful remedy where the teeth sensitivity is so marked that even the touch of air, inhaling air by mouth, also aggravate the pain. Cold touch aggravate the pain. Even warm drinks aggravate the pain. So it is a sensitive toothache where the caries is also there. So miasm here psychotic as well as syphilitic as well as acute, and that's why it is a wonderful remedy even in acute toothache when there is a caries also present. I think we'll stop over here, and rest of the remedy will continue with tomorrow's session. And this remedy we have to understand in depth. Tomorrow I will share few more cases of the Staphysagria. There was one question asked by someone that sepia, whether you repeat in 3 doses or you give 3 doses in a day. Yes, I used to give 3 doses. 3 doses means it is nothing but the 1 dose only. They are not 3. For our understanding, we call them 3. It is, if you are giving same remedy every 15 minutes in same potency, it is nothing but the same. No, it is for surgery. You should use the potentized remedy, not mother tincture of Staphysagria, not at all. So that's all for today. Thank you being there. We'll meet
Hello, sir.
again. Yes,
हॅलो. हा
yes.
सर, सर तुम्ही काल म्हणाले की सेपिया आणि लॅक्टेसिस, सॉरी, पल्सिटिला आणि लॅक्टेसिस नंतर सेपिया नाही द्यायची, म्हणजे त्याच्यामागचं रिझन काय आहे कळू शकेल का?
Inimical remedies. They are mentioned as an inimical
अच्छा, अच्छा.
remedy.
फक्त
Inimical
एनिमिकल
remedies,
आहे. आणि जर ओके, हा हा,
inimical remedy relationship जिथं असते, wherever there is inimical remedy relationship, one remedy should not be
अच्छा अच्छा
followed immediately with other, because both of them are having very close similarity in their action.
अच्छा, हा हा हा.
Always similar remedies becomes inimical to each other, and
हा सर,
opposite
ऍक्च्युली मी
poles always complements each other.
एका पेशंटला पल्सिटिला दिली आहे, पण आता असं वाटतं की सेपिया आहे, तर मग काय करायचं? अँटिडोट करावं लागेल का
Wait
त्याला?
for some time. Don't go for immediately change of prescription. Wait for some time. Let us see what happens after some time.
नाही, पण ती
Immediately,
बंद केल्या बंद केल्यानंतर किती दिवस थांबावं लागेल? जर पल्सरीला इन केस बंद केली
at
तर
least at
15-20
least
दिवस
for
की
at
1
least
मंथ?
for a 15 days, 20 days, you can
अच्छा,
wait and see what happens after that.
ओके सर, ओके, थँक्यू
Okay.
सर.
So thank you. We'll meet again tomorrow. Good night.
Thank you, sir. Good night.